Welcome to CNM Switzerland's summer series on big trends. Today we're talking about digital health and I'm joined by Philipp Wustrow. He's the co-founder of OnlineDoctor. Hi, Philipp.
Hi, Tanya. Thank you for having me.
Thank you for joining. So OnlineDoctor exists for 3 years and you specialized on dermatology. First, how does it work and why this field?
Yes, the field of dermatology is really particularly well suited for digital applications. And the reasons for that are manifold. Dermatology is really a visual subject, so dermatologists perceive or obtain a lot of information just by looking at pictures of skin problems. So you get a very good first idea just by a visual diagnosis. And compared to other medical fields, blood or saliva samples are not necessarily required for a professional diagnosis. And actually studies from the United States and Germany provide evidence that about 85% of all skin problems can be solely digitally diagnosed, which is of course a huge opportunity that we recognized back then, and that's why we developed OnlineDoctor with a focus on dermatology.
So you actually have this service that people can send pictures of their skin problems and then a doctor analyzes it.
Right.
Walk us through.
Right, absolutely. I mean, in general terms speaking, we are a teledermatology platform. So everything that's related to the diagnosis and treatment of skin problems is related to our platform. We are really focusing or rely on a technology in terms of a store and forward technology. So we focus on the asynchronous communication between the specialist and the patient. Let's assume or suppose you would have a skin problem, a rash for example, and you really want to avoid the long waiting periods and the physical appointment, then you would just go to onlinedoctor.ch. So you don't have to download an app at the App Store, but you can start right away with onlinedoctor.ch. And you can choose your preferred doctor. So you explicitly decide who makes the diagnosis for you. And you can choose between about 130 different dermatologists from all different language areas of Switzerland. And when you have done that, you will be forwarded to our interactive chatbot that guides you through the questionnaire, asking all questions regarding your skin problem and your symptoms, really with the idea to collect and obtain all relevant information for the remote diagnosis. And the concept behind this interactive approach is really trying to see how the digital process can be recreated in terms of the physical specialist and patient conversation. So the chatbot asks about your symptoms, where your skin problem appears, for how long you have it, and then you take 3 pictures of your skin problems, usually with your smartphone, and you pay 55 francs and receive your diagnosis and recommendation for action within 48 hours. That is our whole B2C pillar, but we actually have a second pillar in the B2B sector. So our service is not just limited only to requests from patients, but we collaborate with large pharmacy chains, with hospitals, with elderly homes or general practitioners who do the request as health professionals for their patients.
And you work with a network of doctors in Switzerland, as you mentioned. How do you convince them to join? I guess they also work usually in their own places and then Absolutely. They do this on the side.
Absolutely. Yes, I mean, looking back 3 years, I would have never expected that we would count over now 500 dermatologists in 3 different countries, namely Germany, Switzerland and Austria, as our customers. And I think the reason why we were able to convince so many specialists in such a short period of time are that certainly that the platform has been developed by dermatologists for dermatologists.
Really what do you mean by that?
Yeah, really, absolutely, really taking into account their needs. The platform was really developed in close coordination with the feedback of the dermatologists, with the needs and their ideas. So it's basically a product of their ideas. That's what I mean by dermatologists for dermatologists. And of course, in our founding team, we have a dermatologist as well. And so that's how the idea was initiated.
What are the advantages for them? I mean, for the patient, I get it, it's quick, you can just take a picture, you don't have to go there. But at the end, it's 55 francs, so it's not too expensive.
Right.
What's the payoff for the doctors?
Absolutely. I mean, maybe you have to take a step back to answer that question. So basically, before OnlineDoctor existed, dermatologists already received requests from patients asking for a fast remote diagnosis, but they received such requests via email, WhatsApp or SMS. So really unprofessional channels that are not in line with data security, for example, and the documentation itself was very unprofessional. And we were able to professionalize those requests via OnlineDoctor and really create a tool that is a process optimization tool for the dermatologists themselves, and they can use it to triage, to perform a triage and really see what cases are more severe than others. And certainly how we develop or build our network is through word of mouth in this community. And of course we visit conferences or congresses where we promote our product and our service. And regarding Germany, we were able to enter into an exclusive partnership agreement with the Professional Association of German Dermatologists that enables us to basically have access to a network of about 4,000 dermatologists in Germany, and that association actively promotes our service, actively promotes OnlineDoctor towards its members.
Telemedicine saw a surge during COVID-19, so did you. How did that impact your business and what are the learnings?
Right. Yes, I mean, COVID-19 is a real game changer. There's no doubt about that. And I think there are no more excuses now anymore in terms of applying digital health services. I think the advantages of digital health were really presented quite ruthlessly by the pandemic towards us. And we see already the change that COVID-19 brings to our healthcare systems. I mean, the pressure on public institutions and politicians to promote digital health services is rightly increasing. And I think we are moving into the right direction right now. More specifically, the impact on our business model was, of course, very significant. I mean, COVID-19 had and has a very significant impact on our business. During the heights of the pandemic, we really recognized growth rates of about 500% in terms of numbers of requests are being made, and the number of dermatologists that wanted to join OnlineDoctor has increased substantially as well. So overall, I think COVID-19 really acts as a catalyzer, accelerating our market penetration significantly, and we should see that really as a unique opportunity to transform our healthcare system in the sense of digitalization.
So you're talking in general, you think that there must be a change. Are you now thinking as well that you might adapt to any needs? Are you thinking of offering different services, or are you staying with dermatology?
Yeah, the pandemic really has shown us that we are really active in the sweet spot, so to speak. I mean, we had many dermatologists during the pandemic that treated their patients exclusively from their quarantine via OnlineDoctor, so a virus-free diagnosis and professional diagnosis. So we really saw that we had an impact, a positive impact, and I think that's why we also stay with our focus in the area of dermatology. But of course, we are reaching out to other medical fields as well, besides dermatology, looking where we can apply our store and forward technology in a useful way.
Okay, so you could actually, yes, sell your tech for other services.
Correct.
Okay.
Absolutely, that is possible, yes.
But you don't really replace an actual visit to the doctor, do you?
No, it's we have as we call it, digital case closing quota of about 87%, meaning that only in 13% of all cases a physical appointment is needed after a digital appointment or consultation via OnlineDoctor. And that is the service, yes.
And then looking into the future in general, when you look at digital health, is there anything that you see that there is a need for?
Absolutely. I mean, really talking about the future of digital health excites me. It's really interesting to see what the future will bring. And I specifically think that the area of predictive analytics has a huge impact. So really predicting the likelihood of a future outcome based on past data. I think that has really great potential. Secondly, I think genomic medicine, really young discipline, but something with a bright future as well. So ideas really talking about how genes interact with our health. And thirdly, last but not least, I think improvements in the management of long-term conditions. It's not just a huge market there, but really an area where we can, as technology providers, really benefit the patients that suffer on a chronic disease. So these are certainly 3 fields where I see great growth and I personally have on my radar. But maybe another thought on that, talking about the future of telehealth. I really think that we talk a lot about possibilities that lie ahead of us, that lie in the future. And there are dozens of studies really telling us what we will be able to do and what kind of technologies will revolutionize the healthcare system. Also, telemedicine is then usually talked about in that context. But it kind of implies, or at least creates the impression, that we are not ready yet. And as a funny side note, when I present OnlineDoctor to friends or other people, I often get the response, this is great, this is awesome, this is the future.
But it's already happening.
Exactly. This is the present. And it is the future, that's correct, but it's also present right now. And I think we are currently living in times where we are able to make change happen today. And I think it's important to apply a mindset focusing on the now, trying really to force us to have an impact and to act now. Because I don't think we are lacking exciting ideas. We're more lacking on the implementation part.
And what are the next steps for you? I mean, you're available in Germany, Austria. Are you thinking about further expansions, financing rounds?
I mean, we have a clear strategic roadmap on how we want to develop OnlineDoctor, and building on our successes that we are having in Switzerland and Germany. We are really reaching out to other European countries, really trying to see in terms of the attractiveness of the country, in terms of their legal situation, but also how strongly they support digital health applications. So we could talk about France, we could talk about Spain or Great Britain. That's certainly a first next step for us. And on top of that, we are quite significantly developing our technology of our platform. So we will, in the next couple of weeks, deploy a unique e-prescription solution that is based on a blockchain technology. Okay. So that's certainly a feature our customers and certainly we are looking forward to as well. And as I mentioned before, we're also looking at different other verticals besides dermatology. And as you can imagine, that is not possible without a great team. And I think we have the best team. We're really an awesome team. And our key task is also forcing the recruitment process, expanding our team, and hiring new exciting personalities. And of course, I mean, in order to reach these goals in a reasonable amount of time, we are dependent on external funding. We have great investors, experienced and strong investors in our team already, but we are planning to close a financing round end of this year.
Okay.
So,
and how much are you aiming for?
About 5 million Swiss francs.
Okay, you need that to do all these further expansions, hiring more people.
Exactly.
Okay, thank you very much and good luck with that. Thank you for joining.
Thank you very much, Tanya.
Yes.
Thank you.
That was it for today's interview, and if you want to catch up all of our content, then go on cnnmoney.ch or check our social media channels. We're on Facebook, LinkedIn and Twitter. Thank you very much and goodbye.